If you don't want to be recorded publicly online, just please make sure that you turn off your camera if you don't want your image to be recorded. There are obviously a lot of people in this chat right now in this Zoom. So we're really asking one to please keep your mics off and put questions in the chat so that we can make sure to get to your questions. We will be having a Q&A session at the end of the meeting and also small groups so everybody can be heard. But I just want to feel that it's important to clarify that having questions in the chat will make sure that all the folks that are here from the districts, from the teachers union, that are doctors can really try to answer your questions. Also, when you're, please also introduce yourself now in the chat. And also when you're speaking, make sure to share your name, your school, whether you're parent, staff, student, community member. And now I'm going to actually pass it over to a couple other folks who are going to be speaking tonight. I'm going to pass it over to Anevay, who's actually going to go over community agreements. And Anevay is a student at Oakland High.
Hi, I'm Anevay and I'm a freshman at Oakland High. So today's community agreements is listen for understanding, assume positive intent, address, don't dismiss others' concerns, equity of voice, make space for everyone to participate in the small groups. And I feel like it's really important to have a type of meeting like this and kind of get everyone's inputs, including the parents, the students, because I feel like everyone has different feelings towards this. And I feel like this is a very important subject and a big subject because of what's going on right now. And I just feel like everyone's voice and input is really important so we can make the best decision that everyone feels comfortable and happy with. Thank you.
Thank you so much, Anevay, and it's really great to have so many people here tonight. Again, I'm Sam Davis. I'm the school board director for District 1 and the vice president of the board, and I'm just really hopeful in this moment. I know that it's a strange moment of darkness and light with the pandemic being so serious, and yet we're also in a moment with a new federal administration that will hopefully be much better at bringing resources to bear to end the pandemic. So I want to emphasize that tonight, this is a different conversation than the one that we were having last fall, which was, last fall it was really about, is it safe to reopen or is it not? But as you will hear later on, Oakland Unified is already running small in-person learning pods for students of greatest need on a few campuses. And we will be using the lessons on how to do that safely to scale up to serve more students, whether that means on-campus distance learning pods supervised by non-instructional staff, or if it's hybrid learning with teachers in the classroom. So I don't want to have a debate tonight of, is it safe to reopen? I want us to reframe that and really talk honestly about how to safely continue on the path to reopening. And as we do that, we need to really listen to each other and respect that different people have very different tolerances for health risks. Can we get the next, oh, we're on the next slide, cool. In our personal lives, we've all had to negotiate with family and friends to organize safe gatherings. So I know in my experience, it's not going to work for me to tell my wife, stop worrying, this is going to be safe. I need to listen to her concerns and accept that her life experience means she has a very different tolerance for health risks from me. And the same goes for my brother-in-law, my mom, my aunt, whoever. It's not going to work for me to just steamroll over their objections. Instead, we need to find a way that we can gather safely, respecting each other's needs and building trust that everyone's going to follow the ground rules. Whether we're organizing something for a family celebration or whatever it is, if it means we can only meet on Zoom or if we're meeting in a backyard, we need to work together. And the same is true for the much bigger project of reopening schools. Unfortunately, in OUSD, trust is low because in the past, there's been a culture of not taking problems seriously or not addressing them well. I remember a time long ago when I was working on the Manzanita campus and the ovens broke and the kids all had nothing but peanut butter and jelly sandwiches for school lunch every day for a month. And we should never have tolerated that, but we did. And those are the kinds of experiences that are in people's memories when they worry about how Oakland Unified will handle reopening during a pandemic. And so we need our operations to be safe and efficient, and we can look as a model the free food distribution program over the past year has really been excellent and safe and efficient. And those are the kinds of models that we want to base what we're doing on, and not like other past district initiatives that have been inconsistent. So can we go to the next slide? So this is really a good news, bad news moment. The good news, right, is the vaccine is here, it's effective. You'll hear more about that later on. Education workers are going to be prioritized for the vaccine. They should start receiving it soon. The process of getting the 2 shots and it taking effect, as you hear, is about 4 to 5 weeks. The other good news is that last Thursday, the state finally issued new safety guidelines for how schools can reopen, including requirements for masking, testing, and case rates. And there's been different guidance from the state. The bad news is, of course, that the spike in infections in California is continuing, and there's a danger from these variants of the virus that will possibly keep those rates high for the next month or more. And the other anxiety is that the pandemic has been much worse in the flatlands. So some communities are much more reluctant to return to schools than others. Yet we have seen in some countries that the virus has been slowed down, infections have been slowed down. So please tell everybody you know to wear masks, practice social distancing. Let's bring those rates down as fast as we can. And secondly, the rollout of the vaccine has been much slower than we were hoping. And the timeline from the state for reopening schools is not realistic. The new guidelines which just came out kind of reset the negotiations between OUSD and OEA. They only came out last Thursday. And to meet their requirements, we would have to just really negotiate on a very fast timeline. So we are going to do the best we can. We're going to have to work with the state. I really encourage people who are engaging in advocacy to direct that energy to our legislators, to our governor, to put a realistic resources and a realistic timeline in place that will just help us open all the faster. So again, just in closing, I just want to emphasize, it's not should we reopen or not. We are in the process of a phased return to in-person instruction in Oakland. We are following the guidance from the state to do that. We're starting with unhoused and foster youth students, as you'll hear. There are a lot of external factors that have slowed this process down more than we hoped, and we won't get to total normalcy anytime soon. And I have a son in high school. I know that high schools will probably be the last to fully reopen because we can't have crowded hallways. The vaccine is not approved for students, but we are on the road towards reopening, and I hope we can all travel that road together in partnership and collaboration. And I'll turn it back over to Bobbi from here.
Yeah, first I want to just really thank everybody who's introducing themselves in the chat. I realized that I forgot to also explain where my kids are. I have 2 kids who are at Glenview, but which we love tremendously, and we're super excited though to start participating in our neighborhood school, Sankofa. So next year my kids will be at Sankofa. So for the folks that just joined, please remember to put your questions in the chat, or if you just joined, we're asking folks to put the questions in the chat. So if we don't get to it, we can come back and answer those questions. Now I just want to really quickly go over the agenda so everyone's sort of clear about what we're dealing with, or what we're envisioning for the next about hour and 15 minutes. We're a little bit behind, but we're going to try to catch up. And if we don't, that's okay too. So we're going to give speakers about 5 minutes each. We're going to have 2 speakers that are medical professionals speak first. We have Emily Frank, who's a community pediatrician, and Noemi Spinazza, who's with Children's Hospital. So they're going to be speaking for about 5 minutes until about 5:51. Then Tim Douglas is going to join us, who's a teacher at International Community School, and he's representing OEA. And then after that, we're going to have Sailaja Suresh from OUSD talk about the safety planning for about 5 minutes. And after that, we're hoping that we can really have the opportunity to break up into randomized groups so that everybody has the opportunity to talk. And then folks are going to be coming back from those groups to share what the biggest things are for those groups. We're going to have 2 questions. As you can imagine, those questions are going to be, what are your biggest concerns around safety? And what do we need to focus on for preparation and communication efforts to reopen? And then after that, after Jody's going to facilitate that sort of breakout room debrief, and then Sailaja is again going to talk a little bit more about growing in-person learning. And then we're going to do a Q&A session, which is going to be kind of an open forum. So that's a little bit about how the agenda is. We're hoping that we can kind of close by 7, but if not, I'm sure some of us are going to stick around a little bit longer just to make sure. And if your question doesn't get answered, that's why we're asking folks to add it to the chat so that Sam and other folks can be able to get that question answered. So as I mentioned before, our next speakers are Dr. Noemi Spinazza and Dr. Emily Frank, who are both pediatricians.
Hi, everyone. Good evening. It's wonderful to see such a large turnout. My name is Dr. Emily Frank. I'm joined by Dr. Noemi Spinazza. As some of you know, have many roles in addition to community pediatrician. I am also an OUSD teacher, but tonight I'm here on my own accord, and I was asked to help provide an update related to the vaccine, how it works, where we're at, and Dr. Spinazza is going to talk a little bit about the new variants. I think we have 5 minutes, so this is going to be a little bit of a whirlwind. I do want to acknowledge that many of the slides that I'm using tonight come from UCSF and their community initiative regarding vaccination education. So our goals in these very brief 5 minutes are to review in basic terms how the vaccine works and provide some updates related to the new variants. In disclosures, we absolutely do not know everything, and information is rapidly evolving. What I tell you today may be proved otherwise by a new study tomorrow. So at this point, there are 2 vaccines that are approved, Moderna and Pfizer, which are very similar to each other. Both require 2 shots. The Pfizer shot requires 3 weeks between vaccinations, and the Moderna vaccine requires 4 weeks between vaccination. I'm trying a new analogy. If this doesn't work, feel free to give me feedback on it. I'm still figuring out how to best describe this, but I wanted to use an example of Cookie Monster. So Cookie Monster loves cookies. He devours cookies anytime he can see them. If a cookie has a new form to it, he may not know it's a cookie and may not go after it. And so the way these vaccines work can be a little bit described in parallel to what might happen with ordering something. So our DNA, the information that codes everything about us is in each one of our cells. It is fixed. It is not flimsy. I tried to find a leather cased menu, but didn't find one. And when Cookie Monster orders something, a waiter or waitress will write it down on this flimsy piece of paper. This is mRNA. It is not permanent, but it can get a message across. And so this goes to the kitchen where the chefs prepare what they need to prepare. And they are creating a chocolate chip cookie that Cookie Monster has never seen. They're training him to recognize the cookie. They don't want to give him the cookie that could give him increased rate of diabetes. And so they just give the chocolate chips. And these chocolate chips are equivalent to the spike protein. And so when people are getting the COVID vaccine, they are not getting COVID. They are getting instructions, flimsy paper instructions that tell their body how to make the spike protein chocolate chips. And this trains our bodies, our immune system, Cookie Monster, to recognize those spike proteins and devour them. Like this. This is a more common picture that you may see in the literature. So here's the coronavirus and here are the spike proteins. This vaccine contains the instructions for making the spike protein. So these instructions go into our cells. Our cells temporarily make spike proteins so that our bodies are taught to recognize them. That way, if the coronavirus enters our body, it recognizes those spike proteins and destroys them. How well does the vaccine work? We think and hope pretty well. In the initial trials, about 95% efficacy was shown, suggesting that it works quite well. In terms of safety, so far this vaccine in the short term has been shown to be quite safe. We don't have long-term information at this point. Most common effects are arm soreness, fatigue, headache, and fever. There have been some anaphylactic, meaning systemic allergic reactions, but those have been very minimal, and most of them occur within 15 minutes of giving the vaccine. At this point, all people are monitored for at least 15 minutes afterwards, and so the chance of catching that reaction were it to happen is quite large. What I want to define in my last minute is what we do know and what we don't know. So we do know that this vaccine has high efficacy in folks older than 65 years old, in both sexes, across age groups. However, it's important to note that it has not yet been tested on children. Those trials are recruiting right now, but it's been proven in ages 16 and up. It has been tested in a variety of races and ethnicities, as well as people with a variety of medical comorbidities. We also know, that the second shot tends to be the one that's more likely to cause symptoms. Here's what we don't know. We actually don't know if it prevents asymptomatic infection. What they tested in the trials was whether or not it led to symptomatic infection and serious infection. We don't yet know if it can prevent transmission among people who don't have symptoms. We have not yet seen much in the way of immediate rare side effects, but are continuing to monitor for those. This has not yet been studied in pregnancy. As I mentioned, trials have not yet happened in kids. More time must pass before we know about long-term side effects, and we don't know how long the protection will last or if we will need booster shots. California is working on vaccine distribution. There is a lag happening. It's happening both at the federal level and the state level, and that impacts what can happen at the county level. But right now we are still in phase 1. A lot of healthcare workers have been vaccinated, though not all, and we're starting to vaccinate, and a lot of folks in long-term care facilities have been vaccinated. The next step is folks 65 and up, and this is getting slowed down by vaccine supply. Following that will come essential workers, including school staff. And so that's my update in terms of where we're at with the vaccine and what we know so far. I'm going to hand it over to Dr. Spinazza.
Thank you, Dr. Frank. I want to acknowledge that in the chat, people are inquiring why we're talking about vaccines and variants. We're here as physicians to provide some updates about what have been the hot topics, but certainly more to come with regards to other aspects of returning to school safely. I was asked to speak a little bit about the variants that have been in the news, again, so that as parents and teachers, as we're all digesting the news, you have a scientific perspective on what we're actually hearing and learning about. Looks like the slides are reloading. Next slide, please. So next, perfect. Why do viruses mutate? Viruses are really simple things, entities with one goal: make more copies of themselves. What they do is they take over our cells, our bodies, and they try to make more copies of themselves. And they're pretty sloppy at this, which means that mutations can occur pretty easily. Next slide. Inside COVID, there's actually very few ingredients. There is, in the genetic material of COVID itself, there's instructions for how to make that spike protein, those chocolate chips that Dr. Frank was talking about. That's what latches onto our cells. It's like a key inside a lock that opens the key into our cells so that they can get in and make more copies of themselves. There's information for how to make RNA polymerase, which is what the viruses use to copy themselves, and then information for how to make scissors to cut those new pieces of genetic material to make more copies of themselves. It's really, really simple stuff, and it's really, really primitive stuff, and it's really low quality, and that means that, again, it's sloppy and it can make mistakes in its copying of itself, and these leads to mutations, variants. Next slide, please. So you've heard a lot about the British variant in the news and how it's more contagious. And here are some key points. Yes, it seems to be more contagious. We're not sure why yet, but I'm going to show you some data that it does seem to be a little bit more contagious. But, and this is really important, and I saw some questions in the chat about this, the same mitigation efforts that we have been talking about since March of last year, masks, physical distancing, stable cohorts, improved ventilations, still work to decrease transmission. There is no evidence that this British variant causes more severe disease. It just seems easier to pass to the next person. And announcement today, the vaccine still provides immunity. So next slide, please. A study was published from the National Health Services. They did contact tracing of people who were infected with COVID, both the variant, the British variant, as well as the non-variant. What they found is that the variant is 30 to 50% more contagious, but it's hard to understand these percentages. So let me put it a different way. If you get COVID and you have the non-variant, you are there's an 11% chance, 1 in 10, that you're going to give it to someone else. If you have the variant, you have a 14.7% chance of giving it to someone else. So yes, it's more contagious, but it's not like crazy more contagious. And young kids continue to be less contagious than adults. That's why we are still focusing on, besides the fact that the vaccine has not been studied in children, but also it is also why it's really meaningful to vaccinate the adults, because the adults are more contagious, they're more likely to spread the virus. They have been the greater agents of driving disease spread to this point in this pandemic. Next slide, please. What about school? So there are two types of contact, okay? If I have COVID and I'm in contact with someone, I am in direct contact to them if I'm not wearing my mask and I'm face to face or skin to skin, or if I cough or sneeze or spit on them, okay? That's direct contact. Versus close contact is maybe I'm not masked, but I'm within 3 feet of them or 6 feet of them, and for a limited amount of time, within 15 minutes, right? So direct contact is home life. Direct contact is, I have COVID, I don't know it yet, I'm just starting to feel sick. What are the chances that my husband is going to get COVID? Close contact is something that could happen at school, because even with universal masking, there's a chance that people are going to take their mask down for a minute. Even with so good physical distancing, there's a chance that people are going to come a little bit closer for intermittent periods of time. What we have seen in the UK, both with the variant and the regular COVID that we've been seeing until now, is that direct contact is twice as likely to transmit. So what we are saying is the way that we've been seeing disease being spread around until now with closed schools is from direct contact, okay? Not from the kind of close contact that we might see in school. And that mitigation efforts work. This is why we need to continue, and there's no big difference in the spread between good old COVID and this new variant. So the same measures apply. We gotta wear a mask. Everybody has to wear their mask. They have to wear it all the time. It doesn't work if you wear it when you walk into school and then you pull it down onto your chin because you got tired of wearing it. It has to be all the time. We have to maintain safe physical distancing. We need to maintain cohorts, so the same group of people are seeing each other every day over and over, so that if there is an exposure, the exposure is not cross-pollinating different classes in different schools. Next slide, please. There is another variant that's in the news. It's a South African variant. This one is newer and is still being looked at. Studies are being done to see if the vaccine is as effective with the South African variant as it is for the British variant and good old COVID variant. That's how I'm going to refer to it now. What you might see in the news is studies suggesting that if you give people with this new variant, convalescent plasma, the convalescent plasma doesn't seem to be as effective, but that's not the same as the vaccine. So we're waiting for the studies. Next slide, please. So my take-home points of this whirlwind tour is variants are to be expected. These are viruses. They're sloppy, very primitive things. The primary goal continues to be to use the public health tools that we have at hand to minimize the spread, and they work. Avoiding non-essential gatherings. What we do in the community, nothing to do with school, what we do in our personal life is going to be the most impactful thing. Avoiding gatherings with people who live outside our household, especially if the gatherings involve eating or drinking, where we take on our mask and we spit. Wear a mask all the time, observe that physical distancing. The vaccine is an important tool in the toolbox of things that can help us prevent spread. And it's not the only thing, and it might be subject in terms of effectiveness to these variants. Thankfully, these mRNA vaccines are also really versatile and can adjust to the variants. It just takes some time in terms of adjusting production as well. And most importantly, we all have to do our part. And that's it.
Thank you so much to both of our doctors for rooting this conversation in science. I see that there's a very lively chat, and thank you for all the folks adding questions. Also, thank you for the folks that are sharing ideas about how to safely reopen or just sharing your personal opinions. Just want to remind folks to just, hold space, that people have different opinions in this space, and also hold that we don't fully know everybody's position. So let's hear from folks. So the next person we have is Tim Douglas, who is a teacher at International Community School, is going to give a perspective tonight on behalf of the Teachers Union, OEA.
Good evening, everybody. Can you guys hear me?
Yes.
Thank you, everyone. Good evening. I hope the day after the inauguration finds you all safe at home and hopeful. Muy buenas tardes a todos y a todas. Espero que se encuentran sanos y seguros durante ese tiempo pasado. I would like to thank School Board Vice President Sam Davis for inviting me to tonight's town hall and bringing us all together. My name is Tim Douglas, and I'm on the Oakland Education Association bargaining team. I'm also in my 10th year of teaching in OUSD at ICS, the International Community School in the historic Fruitvale neighborhood. My first 9 years were spent in kindergarten, and this year I've looped up to 5th grade. While learning a new curriculum and grade level has been challenging during distance learning, it has been special to teach students who were in my kindergarten class 5 years ago and to see them grow into bright, empathetic, and thoughtful young people. The OEA bargaining team is committed to working with OUSD to better serve our students, families, and community during distance learning, as well as working with OUSD and other labor partners to finding a path to reopening. I was elected to the bargaining team in the summer of 2020 and have continued working on this team during distance learning. While OEA and OUSD have met on a regular basis throughout the fall, over the past week, we have stepped up our hours at the bargaining table. On Tuesday, after a full day of online learning, our OEA Safety Subcommittee met in the evening to review new state regulations regarding safe in-person instruction. Yesterday, Wednesday, our bargaining team was on release to bargain with OUSD. We met at 9:30 a.m. and bargaining caucus until 5:30 p.m., exchanging proposals and reviewing contract language. Today, our bargaining team again taught a full day of distance learning and met with OUSD and exchanged proposals until a few minutes ago. So the main point of focus for our team and OUSD is safety. Again, we are scheduled next week to meet as a safety subcommittee and to meet at the bargaining table with the district. We hope that this—
Excuse me. Hi, Tim. Sorry, this is Jody. I just got a request from our interpreter if you could speak just a little slower. Thank you.
Thank you, Jody. I'm sorry. Thank you very much. As my students also remind me, Mr. Tim, slow down, Mr. Tim. Okay. Okay. So thank you for that. Sorry. Just to recap, while OEA and OUSD have met on a regular basis throughout the fall, over the past week, we've stepped up our hours at the bargaining table. On Tuesday, after a full day of online learning, our OEA subcommittee met in the evening to review new regulations regarding safe in-person instruction. Yesterday, Wednesday, our bargaining team was on release to bargain with OUSD. We met at 9:30 a.m. and bargained until 5:30 p.m., exchanging proposals and reviewing contract language. Today, our bargaining team again taught a full day of distance learning and met with OUSD from 3:30 until a few minutes ago. The main point of focus for our team and OUSD is safety. We are scheduled again next week to meet as a safety subcommittee and to meet at the bargaining table with the district. We hope that this schedule demonstrates to the community the seriousness of our negotiations and that OEA is committed to bargaining in good faith with the district. As eager as we are to come to an agreement with OUSD, this path has many real roadblocks. The recent spike in cases, the delay in vaccinations, and the new regulations from the state are all big rocks that we're trying to push forward. The Bay Area remains under the regional stay-at-home order due to regional ICU bed capacity being below 15%. Teachers, students, and families want to get back on campus, but we cannot do so until it is safe. I look forward to hearing from everyone here tonight. As many leaders in this arena have said, if you want to go fast, go alone. If you want to go farther, go together. OEA and its bargaining team is committed to working together with the district, families, and labor partners to find safe solutions that support our students. Thank you all for being here tonight. I hope you're all safe, healthy, and hopeful at home. Thank you very much.
Thank you, Tim, so much. Before I go next to our next speaker, I just wanted to share just one thing. I actually used to work on bargaining contracts for the city and county of San Francisco and the city of Oakland. And it's not typical for contracts to be open bargaining. Bargaining tends to be, collective bargaining thing tends to be not done in that style. But definitely I know that the union hopefully will come to folks with updates. And thank you, Tim, for being here today. I wanted to just name our next speaker, and then soon we're going to get into the possibility of small groups, which is really exciting to hear from folks about what they're thinking. And just FYI, if you're writing in the chat, it is going to be, we're going to read it carefully to make sure that those questions are responded to, and also take consideration to the folks, to the comments that you're making. So I just want to be clear that if you write in the chat, you're definitely, your comments are being heard as well. So our next speaker is Sailaja Suresh, who's with OUSD, and he's going to talk a little bit about safety planning.
Thanks so much, Bobby. Hi, everyone. Good evening. Thank you for being here. I just want to appreciate all of the parents who are here, all of the staff members and teachers who are here. Everyone has had a very long day, I'm sure, in what is probably the longest school year in living memory. And I just want to, appreciate and acknowledge how hard and challenging this year has been, and appreciate people for taking the time to engage in this process. I always really learn a lot from everyone who comes to these about the things that we need to be thinking about and considering. I am in charge of a lot of COVID coordination for the district. This is my 13th year in the district. I was formerly a teacher and a principal in District 1 at Oakland International High School. Much love to Oakland International people in the room tonight. So what I'm going to be talking about are some of the state and county standards that exist around safety. How that has impacted our preparation in OUSD and what we're doing about safety. And then talk about what some of the plans are that we are thinking about for in-person learning. And related to that, the process for returning to in-person. Next slide. And so what I want to start with is just doing a pulse check. I've been reading the chat, and there's a lot of questions about reopening. I would like to get as specific as possible when it comes to this portion of the safety presentation. So if there are specific things that people want me to address or spend more time on, I would like to know what those things are. So you can go to this website, you can use this QR code. You can also go to menti.com, and I'm just going to type it in the chat right there with this code. And if you do that, I'm not sure, Sam, if I have the ability to share my screen. I can show you essentially the sort of real-time poll of what people are thinking about right now in the audience, so that we can make sure that we're tailoring our conversation to those topics. And so there are 8 different topics here: PPE, ventilation, staff and student COVID testing, custodial practices, our responses to COVID cases, symptom screening, campus setup, and safety compliance. So, of those 8 topics, what are the things that you would like me to spend some more time on and explain how we are preparing in the district? So I'm going to wait. We've got one person who's weighed in so far. They are not at all concerned about the things, but I know that there are concerns out there about certain things. So this is adjusting based on more people who are taking it. And I'm going to touch a little bit on each of these topics during the presentation, but again, want to spend some more time where there is more concern. And one thing to note is that vaccines are not on here, as Dr. Frank was explaining at the beginning of the presentation. That's really something that the county public health department is coordinating. So it isn't something that we necessarily have control over, that we are waiting for information, as many of you are, as to when phase 1B might begin for our educators to get access to the vaccine. So I'm gonna wait for a few more people to take this. We've got about 11 people so far who have weighed in. I know that we've got more than 100 people on tonight. So I'm going to wait for a few more responses to get somewhat of a representative sample here. And it definitely seems like, you know, there's still some movement here. But I will go ahead and Jody, have you bring the deck back up as the rest of these responses come in so that I can move on with the presentation. Great, and you can go ahead and go to the next slide. Okay, so starting on some of the context here. You know, on the left is a graph that shows the context of the national reopening situation, and then the California specific reopening conversation. And wanted to provide this as some context because the conversations that we're having here, the struggles that we're having here, the frustration that we're having here is not unique to us. And I also want to just really echo the fact that like I don't want this to be pitted as like a either or kinds of situation of like an open versus closed situation, and reiterating some of Sam's comments from the beginning of we are in the process of a phased reopening. And how can we kind of keep the door open to having that conversation, and really not casting blame. And so, you know, looking at the national context, there's really very few districts that are open in full capacity in person, right? So that's the sort of top magenta section there. If you look at public school districts around the country, only about 28% are actually open for full in-person learning. And then there's a big batch of public school districts, of which Oakland is one of them, 60% or so, where there are some students who are receiving at least some services in person. And then there's a very small number of public school districts, really about 12%, that are pure distance learning. So there's no children on any campus, on any site, anywhere receiving any in-person services. These numbers were also pre-winter break, and so those numbers might have been shifting since then, but is a good snapshot that is comparable to the snapshot of where things are in California, where California generally has had sort of a more slow reopening across districts around the state, where as you look at Alameda County, most districts in Alameda County of the 19 districts that are here are in distance learning. And you know, what is true is that most of the districts in Alameda County have submitted reopening plans of here's how we'd like to reopen to the county, but most do not have labor agreements that would allow us to proceed far down that reopening plan. And so I'm going to talk a little bit later about what we are doing right now and sort of what we hope to do next in this phase reopening. Next slide. So just really briefly, a lot of you have seen this slide. We've been using this since last spring, just saying that whatever we do really needs to be grounded in science and safety recommendations from the public health experts. And then really from that, we derive what we need to be doing for staff support and for student learning. And so I appreciate Dr. Spinazza and Dr. Frank framing for today, and then hearing from our OEA representative as well about staff support and what we should be doing to support our staff. Next. So this is referencing a study that was done at UC Berkeley around different mitigation factors in schools that have reopened that can prevent the spread of COVID. So if you look down the y-axis, up at the top, what you'll see is if there are no additional precautions put into place, right? Schools are reopened, everyone should come back, nothing is required, no masks, no nothing. what you see then is that there is a likelihood of spread of COVID, both amongst teachers as well as amongst students. And the modeling shows, right, that for older students, as Dr. Frank said, the sort of transmissibility of the virus is higher. And so you see a higher likelihood of spread amongst secondary teachers, secondary students, and a much lower likelihood of spread with elementary school students, elementary school teachers. And then going down the y-axis, the study looked at what was the different impacts of different kinds of safety measures for COVID, right? What if we did monthly testing of teachers? What if we did weekly testing of teachers? What if we did testing of teachers and students? What if we used masks? What if we did stable cohorting? And so sort of where we are is all the way down at the bottom, the second to last line that says stable cohorts, masks, and monthly teacher testing. Where if you do all three of those things, it brings the risk of contracting COVID and spreading COVID in the school setting basically down to zero for both teachers and students. And these are pretty basic requirements that the county would expect us to comply with, that the state would expect us to comply with, and that we have been preparing for at a minimum. And I'll talk a little bit about how we are going over and above what the minimum standard is that was established in this study, as well as that is being recommended by the state and the county. Next slide. So here's again some framing from the state and the county. So on the left, you have the state's tiering system, right? Where they've said, you know, based on how much COVID is in a specific community, there is the purple tier that is widespread, red, orange, and yellow. Currently, the way it stands, we are currently in purple. Both the state and the county, as of right now, recommend that small cohorts, like small groups of students coming back on campus, is okay and is allowable, but that schools as a whole shouldn't be reopening until we drop down into the red. What we have submitted in our plan to the county is that in terms of widespread school reopening, that is something that we would be comfortable doing if we were in orange. One thing to note is that the governor recently made an announcement, like he made a proposal for like a safe schools for reopening for all. And in that proposal, he basically recommended that schools be allowed to reopen even if we are in the purple. His proposal that like has funding attached to it is currently making its way through the legislature. So we will have to see how that language gets amended and what kind of pressure or what kinds of regulations will get placed upon districts and upon schools really over the next few weeks as the legislature makes some decisions about what the governor's proposal is. And then finally, the county takes, you know, all the guidelines and advice from the state, from the public health department, from the governor's office, and they have a set of guidelines that they expect all districts to follow. Really at the core of that is making sure that when students do come back, they stay in small groups that are stable, so same adults, same kids, so that if there is a COVID case, you know exactly who the individuals are who were in close contact, who would then need to quarantine. That we make sure that we're ensuring that there's physical distancing, so we're not bringing all the children back and all the adults back at the same time, and that we're setting up classrooms so that desks are 6 feet apart, and that we're making sure that everyone who is coming on campus is doing a daily symptom screen. So if you have a temperature, if you have a cold, if you have a fever, if you have a headache, you are not coming on campus and you are staying home. And then finally, the last requirement is that we make sure that we have face coverings for all staff and all students, and that is a requirement for being on campus. Next slide. So Dr. Frank spent a lot of time talking about vaccines, so I'm going to go pretty quickly here. Essentially, we are in phase 1A now. We want to be moving to phase 1B soon. That is when educators would be eligible for taking the vaccine. We don't yet have enough information about when this will happen. So that was some context from the state and the county. And now I'm going to talk about how that has translated into what we have been doing to prepare. Next slide. So many of you might have seen, we have a readiness to return dashboard that is on the website that talk about these different areas, safety, custodial, facilities, and how we have been preparing to reopen and how much progress we've made towards reopening. I'm going to talk a little bit about the different areas that we've been preparing in, and also just say that we're working on preparing a like school by school dashboard so that, you know, if you see a metric that is like PPE 75%, that you can then drill down to your school of what does that mean? Do I have PPE? Do I not have PPE? Do I have ventilation? Do I not have ventilation? So that they're not just high level metrics, but really site by site. And we're working right now with designated safety leads at each of the school sites to work on verifying all of this information before it goes out publicly, so that we're making sure that there are checks on the information and verifications that everything is accurate before it's publicly posted. Next slide. So some of the measures that we are looking at and tracking, right, are, you know, do we have hand sanitizer at the schools? Have we created the site safety plans? Have we upgraded the ventilation? You know, and I saw that there were definitely some questions in the chat about outdoor learning spaces. So that's something that we started working on last summer. We actually had a District 1 parent who was a designer, and she basically had her firm support us in creating, designing outdoor learning spaces and selecting the materials that were compliant with state regulations. This is like the other thing that we're learning a lot about, is that the state has certain regulations that apply to public schools that don't necessarily apply to private schools. One of them is regulations around architecture. And so the Department of State Architect you know, allows instruction to happen at school buildings, but not necessarily other places on a regular basis. So, you know, it's the question of, can we just hold class in other, hold school in other places around the city? We wouldn't necessarily be able to do that, but we would be able to build more usable outdoor space at our school sites. And so really the next step is, right now we're working on building a model using the materials selected by the design team to evaluate if those are the materials that will withstand constant use, and then looking at the sites that need additional usable space in order to build more of those out. So that's a little bit about what's happening around outdoor learning. The other big thing that's happening right now is around ventilation. So over the summer and over the fall, our facilities team went to every school and evaluated what kind of forced air system they had. If they had a forced air system that had a filter that could be upgraded, they upgraded them to MERV 16 filters. And then in many schools that did not have a forced air filter, they are purchasing air purifiers for in the room. And so we worked with the indoor air quality engineers at Lawrence Berkeley Labs to select which kind of filter and which kind of air purifier to use to make sure that no matter what classroom or what building you're in, you would have added ventilation to that room. Next slide. And so here, just like a couple of other things that we've been working on. So PPE, we've been buying, and there's a mountain of it in the warehouse. We've got cloth masks, we've got surgical masks, we've got kid masks, we've got adult masks, we've got face shields, we've got the masks that are like see-through. And the goal is to create, we actually have classroom kits that are assembled that have kid masks, adult masks, hand sanitizer, that would be sent out to schools every week, so that for whatever staff members are on campus, they would have their own little PPE supply kit available to them. So we're working on assembling those and shipping them out to schools over the next few weeks, so that whoever are the staff who would be coming on campus to work with students, when we're ready to do that, they would have access to what they need. And then the other thing that we've been working on, just like sort of on the back end, is making sure that we can respond if there is a COVID case. So we built our own contact tracing system, knowing that we couldn't wait for the state or the county to do that for us, and have a system that's built so that if there is a COVID positive case, it automatically notifies the county, custodial services, any close contacts, as well as providing that individual with information about their leaves and how to get support. And so that's something that we knew that we had to have in place before we had any kind of level of a lot of students or staff back on campus. Next slide. So this is just another way to look at some of the things I've been talking about. In blue are the things that are done. So they're the things that we've been spending the last few months working on. The things in green are kind of the things that are happening right now. They're the like January-ish tasks. And then there are a few more things that are still yet to come, right? So like we don't have all the information we need about the vaccine yet, but we know that that is going to be a big body of work at some point. I will talk a little bit about testing, because I saw that that was something that a few people were interested in. So when we started testing back in November, we were using a company that the county had a contract with. We have since then moved to another company that the state has a contract with, where there's a state-run lab that processes tests for both staff and students. And so we've begun using those tests and are now making it available to any staff who are on campus to be able to come and get tested, and are working with a couple of different options to be able to expand student testing as well. And so for all of our pods where there are actually staff and students on campus, we've been working with them to follow the county guidance, which right now is at making sure that everyone gets tested, about 25% of staff every week. In most cases, staff are happy to get tested even more frequently. And so we've been making sure that testing. Next slide. Okay. And so then one last kind of pulse check here before we pause for Q&A around the safety procedures. So we're going to go back to this website here. I'm going to just drop it in the chat one more time, menti.com, and then the same code as last time. And this one is a ranking. So you can drag from top to bottom, from first, sort of what is the next most important issue that we need to be addressing and thinking about and talking about, so that we can think about in like the next few weeks to few months of work, what are we going to be focusing on?
And actually, maybe we can move into the breakout groups, because those are actually the questions for the breakout groups. We just wanted to have 10 minutes for people to debrief and sort of get to interact a little bit. So I'm going to pass it back over to Bobbi, who's going to discuss just remind us of the community agreements.
Yes, and I see a lot of parents are ready to sort of share their thoughts on this. So we're now going to do the breakout rooms. It's going to be randomized groups of small groups of 4 to 5 people. The only thing I ask is folks to really just, they're not moderated. So just, you know, as much as you can, think of, you know, community agreements and think of other people's perspectives. And then if you can also designate someone in your room to come back to the larger group and share your thoughts about the 2 questions, which are, what are your biggest concerns around safety? And what do we need to do, we being the community, we being parents, we being the district, to focus our preparation and communication efforts? So we're gonna start assigning people right now. Then we're gonna come back to the breakout room. Then we're gonna have Sailaja have a quick second part, and then we're gonna do a Q&A. Great, so I think people are, yeah, I can see that's happening.
Okay, so if you could share, I'm going to try to pull in some questions here. When you talk about just the considerations that are part of negotiations or part of our planning for bringing back potential hybrid schedules, can you also, as you speak to these 3 points here, can you also share in the plan that we propose, there's been some questions about phasing in grade levels, if we're considering, for example, bringing back elementary students before secondary students, and why that would be the case. So if you can speak to that. And then if you can also speak to, as we're getting ready for hybrid schedules, and I'll remind you of this if it's too much, how we're continuing to build out the distance model, if that in fact is part of our plan to have both hybrid option and distance model, to ensure that that's improving as well as preparing for a hybrid model.
Yep, great. So, I mean, I think to speak to that second point of, you know, distance learning clearly is the base instructional model for this year. And I think teachers have been working incredibly hard to shift their teaching online and to make sure that kids are being held and supported and challenged all at the same time. And so, you know, I want to acknowledge that is not going to stop, right? Like that is going to continue happening, even as we begin expanding to more hubs and even thinking about bringing whole groups of students back by grade level. So one of the things that was in the governor's plan that he released last week was a proposal that school districts first start with TK2 coming back, and then grades 3 through 5 coming back, as well as some particular populations of students, specifically students with special needs at all grades, to be able to come back first. And the state very helpfully in January defined what reopening means. And by reopening, they are basically saying that you as a school or as a district are open once you have been able to offer to all students in a particular grade access to in-person instruction. And so that would be the goal if we were moving forward with the governor's plan, is to make sure that we were then providing the opportunity for any family who wanted to at any grade level to be able to come back to receive in-person support on campus. And this slide here that's showing are basically like the 3 primary considerations in figuring out how to do that, right? And it is going to look different at every campus. Right, where first there is the space assessment. And so we had a space assessment that we did over the summer where we looked at, what is the square footage of every room on campus? That then determined how many air purifiers we had to purchase. Based on that square footage, how many children can you fit in the room 6 feet apart? That is going to be really different than how many you would fit during a normal school year. And so that space has a certain set of constraints on a particular campus for how many children they would be able to bring back on any given day. And the second, of course, the huge one is staffing, right? So based on our different labor agreements, that then determines the number of staff who would be able to return at any given site. And that is also inherently going to be different at every school site, where at one site you might have 20 teachers who are over the age of 70 who have underlying conditions. And so the staffing model at that school is inherently going to look different at another site where that is not the case. And you've got a ton of teachers who are ready to come back yesterday. And so how does the district supplement in places where there's a school site with a number of teachers who for very legitimate reasons can't come back tomorrow, and make sure that there are other staff members who are available to support the children who are coming back in person. And then of course, students, we know that the community really is genuinely divided about this. And there are families who, again, are like ready to be back in school, and this should have happened 3 months ago. And then there are plenty of families who really feel very differently and are genuinely concerned for themselves, for their children, for their family members, and are not ready to come back. So we know, again, that the number of cohorts that we would be hosting on any individual site will look really different based on these 3 factors.
Okay, great. So Sailaja, I'm going to kind of pull some things from the chat here as people are responding. So let me stop this so we can see each other, if I can figure that out. So one thing I want to ask here is, there's been some questions, back a little bit to the preparing the safety. There was a follow-up about ventilation and wanting just to be clear that the ventilation that we're planning on putting schools is aligned with the state and county guidelines, because there's been some concern posted around saying that it wasn't. And then as you speak to that, can you also answer how we've used the CARES Act fund and the funding from the state to purchase ventilation and PPE, and how we've used that funding to prepare for the opening of schools?
Sure. So for the ventilation, there's basically 2 things that we've been doing. One, we've been upgrading the filters in existing systems that are already in our buildings to MERV 16 filters. And so this is like 3 grades above what is recommended by the ASHRAE standard, which is kind of like a national society of engineers who focus on HVAC kinds of issues. So we have purchased those. We are in the process of installing those right now. About 3/4 of our sites have systems that can even tolerate this filter. And so we're a little bit more than halfway done with installing those filters right now. In addition to that, because we know we've got sites that don't have inherent HVAC systems, forced air systems, we were purchasing air purifiers. And so again, we worked with the indoor air quality engineering team at Lawrence Berkeley Labs to say, what kinds of air purifiers should we buy? And what is the standard that we should use? And so they gave us a list of acceptable devices that they recommended based on the clean air delivery rate. So basically, how quickly can these machines cycle through a certain amount of square footage of air? And based on that, how many would you need in a specific classroom? The other really important metric was the noise, and making sure that we were purchasing the quietest model on the market so that it could be tucked away somewhere and not interfere in any way with the conversations that are happening in the classroom. And then Jody, you had a second question?
Of how, just you can share a little bit of how we use the CARES Act funding for purchasing materials. And then again, if you, I know we've purchased quite a few masks. There's some questions about how using the filters and the combination of masks and how we're getting those masks to school sites, as you're talking about other things we've purchased too.
Yep. Okay. Yeah. I mean, we knew, for the past 9 months that we would have to do everything that we could to prepare, and we couldn't necessarily wait for the state or the federal government or even the county to tell us exactly when and how to come back to school. So we began purchasing PPE, again, lots of different kinds of masks, cloth masks, disposable surgical masks for both kids and adults, face shields, again, based on the feedback from the pods of what kind of face shield fit on their faces and wouldn't fall off when they were teaching, as well as the masks that have the see-through front for teachers who might be doing sort of speech pathology work or other things where it was really important for students to be able to see their face and see their mouth move. So we have that on hand in the warehouse. And essentially how these are going to get delivered to each school site is through the creation of these classroom kits. And so in each classroom kit, there will be hand sanitizer, there will be adult surgical masks, there will be kid masks, and these will be sent out, I think disinfectant also, and these will be sent out each week for the number of classrooms that are active on each campus. So that in addition to the hand sanitizer that's available at like the entrances and the main offices, every classroom would also have a continuous supply of hand sanitizer for use by the students and the staff who are in those classrooms. So PPE was definitely a big ticket item, like lots of money, because we knew we would have to prepare to have enough PPE on hand for the rest of the year. Technology was one of the other really big ticket items, because we did have to make sure that not just our students had access to technology, but that our staff members also had access to technology. And that's not just teachers, because we've got paraprofessionals who are supporting online. We've got admin assistants who are working from home. We've got principals who needed a new laptop. So making sure that all of the staff and all of the students had access to technology. We were fortunate to have Oakland Undivided as a partnership, so that in addition to the devices that we purchased that we lent out to students, we were also able to give them a device of their own that they could keep even beyond the duration of this school year. So those were the two big things, but I would refer people to our LCP, which is our learning and continuity plan, that has a more detailed budget of here are all of the specific things that we were intending for that money to use. And we're now in the process of reporting on that to say, we said we were going to buy these 5 things. Did we buy all of those 5 things? Did it actually cost that amount? And what else did we do with the money?
Okay, I'm going to take one more cleaning question, and then I want to go into some supports for different students with different learning needs. So there's a question here about just the custodial support at each school and sorry, I was reading it in Spanish, cleaning all the areas around the school. So the process and protocols that are being planned for regular cleaning, if you can speak to that, and then I'll come back to support for different student learning.
Yeah, so in the teams that we had planning over the summer for all of the things that we had to do around reopening, it was really clear from our custodians who participated on the team that they needed support in making sure that they were able to clean more quickly, more efficiently, and to be able to, sanitize a room that had been previously used by students that didn't involve with like a spray bottle and a rag wiping down every single desk. So we purchased electrostatic sprayers for all of our schools and all of our custodians. This allows them to pretty quickly sanitize an entire room. So that's something that they've started doing. I will say also, the concern about custodial and like clean schools is definitely something that predates COVID. And so that is definitely a system that, and like a group that we want to continue to improve with or without COVID. And so the other thing that the custodial team is trying to do right now in particular, where they have the time to focus on training and focus on building systems, is to figure out how to make sure that custodians are that the work is more transparent, that like I cleaned these rooms on these days, and this is how both my supervisor as well as other members of the campus know that. And building in some feedback cycles where, you know, if a teacher or someone comes into the room and is like, I don't actually think that this room was clean, that they have, you know, a direct way to be able to flag that as an issue at the district level, so that we can make sure that issues are resolved in a more timely manner.
Okay, I want to acknowledge that it is 7 o'clock. So if you do need to leave, if you were expecting to end at 7, and I know everybody has things to do in their homes, please make sure your question is in the chat. We are going to record this and take this back for future communication to share out. If you can stay on, we will be able to stay on for a couple more minutes, up till 7:10, I think we're aiming for. And so I do want to ask, there were some earlier questions about how we're supporting students with special needs and students with different languages, both in distance learning, and how we're thinking about supports for those students in the hybrid model or distance learning going forward. So I want to go to that question. I noticed there's a lot of people asking specifically, will we open in the fall? So we'll come to that, try to answer that as clearly and cleanly as possible. But if you can, because this was way earlier in the chat, if you can address how our hybrid planning models and our distance learning models are supporting students with special needs and students with as English language learners.
Yeah. So I mean, one of the first things that we did, I think particularly at the secondary level, is try to work out a way that teachers had fewer student contacts that they had to manage on any given day, to make sure that they had the time to support the students, not just in their Zoom classes, but also in small groups, and of course in the inevitable phone calls and texting that has to happen to make sure that those students are supported, specifically for students who need the additional support. So English learners, special needs students, students who are struggling to engage in Zoom lessons and to participate in distance learning. So I think that that's one thing. I think the second thing is, you know, thinking about like that question around like, are we going to open in the fall or not? You know, obviously a lot depends on our labor agreement. I think the other thing that it really depends on is what the state decides, right? And so for a lot of us last summer planning, there were the plans that we were kind of working on in like the early summer. And then there was the assembly bill that passed in late June that really made the determination for a lot of us for what the school year was going to look like, right? Where the state is the one who determines how many instructional minutes are we supposed to have? How many instructional days are we supposed to have? What kind of learning constitutes in-person, or what constitutes school, right? Where it was really clear in how the state decided that in AB 77 last summer, determined that distance learning as well as a hybrid model were both perfectly acceptable options for this year, which was entirely appropriate. How they shift or change at this moment in time, I think will affect all of us. So not just Oakland, but really every single district around the state in developing what our plans are in the fall. We want to have the children back. I believe the teachers want to have children back. I think everyone wants to be back, but we also want to be able to make sure that we are doing it safely and that everyone is coming to it with the same agreement that it is safe.
Okay, and so let's see here. Some other questions. If we can talk about, and I'm not sure if our doctors are still online, but with vaccines, if you can share, there were some questions earlier with vaccines. We know we saw that educators are in 1B, but wondering about parents of students, or if there's any, if you've been hearing anything. I know we need a lot more information for the state and county on this. Students with special needs or special medical conditions, if there's a priority there, and if their families will be included. We may not know that answer, but if we can be watching out for that as you're getting updates from the county, or if you've heard anything about that, if you could just share a little bit.
I believe that Dr. Frank said that she's here, but she doesn't have access to her mic right now.
Okay, let me find her.
Yeah, and she said in the chat that the vaccine is not going to be approved for use with children for quite some time. So
I'm a primary care doctor, I'm Liz DeLuca, primary care doctor at Kaiser Oakland, working closely with our vaccination rollout. And the higher risk adults hopefully will be vaccinated by then, but during the summer, it will just be starting the clinical trials for the kids. So the kids should not be vaccinated by the fall, but higher risk adults as well as the grandparents, possibly in multi-generational families, should be vaccinated by then.
Great. Thank you so much, Liz, for jumping in on that.
We've already, started vaccinating patients 75 and up, and I've had quite a few patients already have appointments for that.
Okay, so I have, since you're there, but also there was some questions earlier about mental health of students. So just wanting to share, Sailaja, if you can speak about our hybrid planning or even distance learning planning, those focused on the classroom supports, if there's plans about mental health or if there's groups working on that, and then perhaps the doctors as well, if you know of mental health supports that are being offered to families and students at this time.
Yeah, I think that that's a really good and really important question. And it's definitely something that the wellness team has been thinking a lot about, knowing that even during non-COVID times, that like wellness and supporting students who've experienced trauma is really, really critical. I think that our cost teams at our schools have been doing a really tremendous job in reaching out to families on a really regular basis and making sure that as much as possible, we're able to get them the supports that they need. It is not always possible, and it is definitely, I know, something that many physicians around the country are really concerned about, of students' mental health while we continue in distance learning.
Okay, so we are coming to the close of time. I will pass to Sam for some final comments. I do also want to say I acknowledge that I'm seeing in the chat some frustration of not answering, especially a lot of the questions where we don't have the answers completely yet, like perhaps a specific date that we'll be coming back to hybrid learning or opening up schools. So we again apologize that we don't have that answer tonight, and we will keep having community engagements. And as soon as we know that, because of the multiple steps that we're working on, both watching the virus, bargaining, preparations, all guidance from the state, all those factors are what we're watching and looking at as a district to be able to give families a specific date. And we know it's very, very uncomfortable to not have more concrete answers. And so I do see your questions there, even though we're not bringing them. We just don't have the as concrete as answers as you may like, but we will continue to stay in conversation with you all. And thank you so much for spending time with us tonight. So I'll pass it to Director Davis to close us out.
Yeah, thank you so much, Jody and Sailaja and Dr. Frank and Dr. Spinazza and Mr. Douglas and Anevay and Bobbi and all of those who helped us this evening. I hope I didn't leave anybody out. I totally want to just second what Jody just said. I understand it's a really frustrating time. I think we're all, just been in this COVID situation for so long, and yet we still have rates of infection that are so high that, legally we're not allowed to be open right now. So it will take some more time before we can get there. And I appreciate all the hard work that's going in. I don't think, I think some people were expressing how frustrating it is to not know what's going on in the negotiations. And again, I think this pandemic has shown so many ways in which our society is when we don't trust each other, that creates a lot of strain and a lot of stress. And what my experience has been is that everybody who's working on this is working the best they can do with, in challenging circumstances to try and resolve this as quickly as they can. And there are people with different, as I said at the beginning, people who have different experiences with their health. That's why we see different results in the surveys. The pandemic has impacted different neighborhoods differently. It impacts different people based on their job risks, essential workers, teachers, education workers. There's definitely ways in which people are very anxious about what's going to happen. And so I appreciate that we're all trying to work together. I hope we can do this in a cooperative spirit. I appreciate all the people who've offered to chip in and volunteered ideas. And I hope we can have more forums like this to discuss. I know it's frustrating that we can't take everybody off mute and hear from everybody, but we did have at one point over 180 people on the call. So I hope we did get some information out there. And I want to thank everybody for participating and for listening tonight. I will be posting this on my website and making it available if people want to watch the recording later. And we will be saving the chat so we can get some more information and try to get better communication out to people. So thank you so much to everybody. I'll wish you good night. And we will have another, I think, on a different topic every month, but there will be forums on other issues confronting OUSD, and we'll return to this issue about reopening schools later in the semester. Thanks so much and good night.